All right, next up we're gonna go through a standing one-arm cable row. I think it's actually awesome that we've seen both Nate and Ryan move a little bit because it's gonna give us a couple different perspectives on how people will commonly kind of mess up this exercise. Honestly, I think I could do a one-day seminar just on how people mess up rowing patterns. At the end of the day, it really comes down to two things. Wherever your arm goes, your shoulder blade should go, and vice versa. And then two, people just don't like scapulothoracic movement. Okay, it speaks to this whole concept of relative stiffness, that the movement at one joint is going to impact the compensatory movement at another joint. People generally don't like scapulothoracic movement. They don't like to move the shoulder blade on the rib cage unless it's aggressive anterior tilt, is what we see almost population-wide. So you're going to see that in the context of how people move. Tell you what, why don't we have Nate jump in here first. As we kind of jump back to Nate's previous example, we knew he was a big scapular depression guy. We use kind of a subtle anterior tilt guy, and actually that anterior tilt almost kind of became more and more prominent as we went to the landmine press, where he kind of like dumped forward. We had to kind of keep correcting that. So I think what's really good about looking at Nate is that we know that the nature of lats and anterior tilt mean that we know he's probably going to be a guy who wants to be like right in tight, because it's in the line of pull of lats, which are a really big shoulder extensor and adductor, and it's also right in that line of pull that makes anterior tilt work. So let's go ahead and kind of show what that looks like. You see that low shoulder, he's going to want to pull it even lower, so kind of keep the elbow in tight to the side. I don't love that pattern for a couple of reasons, and you can actually show a little bit more. There you go. So first off, when he gets to this end range, and he's doing a good job of restricting the motion, why don't you come just a little bit further? Let that elbow come back a little bit further. You'll notice that as he extends his humerus, the scapula is actually diving into anterior tilt. So instead of this being a pattern where basically the arm motion is kind of driving this movement of the scapula around the rib cage into retraction, he's actually winding up, grinding away in the front of the joint, because as the arm comes back, he dumps forward into anterior tilt. So that's the first thing. The second thing that we really have to appreciate with something like this, and if you want you can set that down in between reps, is when you're in tight like that and you're really working hard on the lats, it's very hard to get that little bit of posterior tilt that people so desperately need, right? So it's not just fundamentally driving anterior tilt from a positional standpoint, but from a pure cross-sectional area, that lat's going to overpower your low trap. So when the scap goes forward, as the arm comes back, you're going to grind away on the front of the joint. Okay, so what's our quick cue for that? Why don't you set right up? And all we're going to do is we're going to give him a little bit of space between his elbow and his side. I usually say like 30 to 45 degrees. So you'll often see me walk up to people and just give it one of these, right? And what you instantly see is, notice there is a little bit of tone in his upper traps. We talked about that's okay for him, right? Lower traps, mid traps, and upper traps, they all work together, right? You're not going to completely shut one off as he goes through retraction. So I'm okay with a little bit here. I wouldn't be okay with this if he was a 55-year-old man who sat at a desk all day and was heavily elevated. So we get that space between his elbow and his side. We also monitor that excursion so the arm isn't way back here. Any kind of motion of the arm coming past the body should happen because of mild thoracic rotation, not because he's just driving his elbow back this direction. So what you'll commonly see me do is I'll be up there and I might just have my arm there and I'll say, you know, stop when your elbow hits my side. And what I can do from this position is I can make sure that that scap's actually getting to where it needs to be, and I can also monitor to make sure that there's no anterior glide in the front. So just staying in that tunnel is really, really important. You can relax. One of the very common mistakes we'll also see is a forward head posture. So we're going to have Ryan jump in on that. Take the weight down a little bit. Nate was working pretty hard there after all these holds. So Ryan has a tendency to shoot really aggressively into a forward head posture. So he does a good job of controlling it. Why don't you just go and do a couple reps on your own, and you'll see that he actually understands the pattern pretty well, understands how to sync everything up. You'll notice as the arm comes out, the scapula goes with it. It works around the rib cage. So he's actually got some really good scapulothoracic movement here, which is something we don't commonly see. More often we see a lot of that. What we will see in a guy like Ryan is almost kind of like this fake retraction, is as he rows, before he gets to the end range, he'll kind of shoot into that forward head posture. So it may cut the scapular movement short, but whatever it is, there's an excursion forward. So go ahead and do a couple of those. And you'll see with him, you actually might get a little bit of like accessory tone through scalenes, SCM, basically anything that shoots him forward. So that's where that other hand can come in handy, right? So for him, you notice he's got his hand on his rib cage. He's making sure he doesn't slip into lumbar extension and, you know, use those lats and, you know, lumbar erectors to kind of pull him into that heavy extension posture. Things we can do for him is, instead of going here or here, we can literally just have his hand right here monitoring chin position. So literally that excursion shouldn't change at all with his head. It's all scapulothoracic motion. So put him in a good position and have him just stay right there. So what do? His hand becomes the external focus cue. Don't touch your chin to your hand. Okay, so go ahead and do a couple of those. If you got a great beard like Ryan, it looks even better. Kind of a pensive position. So Mike, you want to talk a little bit about some of those common soft tissue things that you see?
Yeah, honestly, I think it's pretty similar to what we've already done kind of with like the wall slides on the wall, those same kind of positions with them, especially if we kind of think about both kind of variations that we've seen on these guys. You need good thoracic spine mobility to be able to posteriorly tilt. So it's the same drills that we did before. So pec minor, levator, all those areas are going to be equally as effective as the wall slide as it is going into retraction. So both protraction and retraction, it's similar mechanisms behind that. So without good thoracic spine mobility, you're never going to get good scapular mobility. Everybody always forgets that it's scapulothoracic. Everybody focuses on the scapula and not the thoracic. So you got to really work on those two together there. So one component we've added that's a little bit different now is we've done unilateral, just one arm. So now when we do a cable row, it's the most often one hand. You know, you can certainly do a two-hand row, but with one hand now, you have to use both that thoracic mobility for extension flexion, but also now for rotation as well. So that would be my other variation if they have some struggles here, is just to assure that they have that normal rotation. As much as you don't want to necessarily rotate at your thoracic spine, remember, to keep your thoracic spine stable, you need to have your scapula move around it just as well. Okay, so it's really thinking about the joint from both ends, from the proximal and the distal end, but otherwise it's essentially the same concepts with pec minor thoracic mobility.
I think we need to relate this back to what Mike spoke to during our back to wall shoulder flexion breakout, where he said, hey, people are just losing that ability to get overhead. And a lot of it is training driven, right? It's driven because we have a lot of deadlifts, Olympic lifts, a lot of heavy loading farmer's walks in our hands that are aggressively pulling our shoulder girdles down, right? So we're using those lats to stabilize our shoulders, but also at the same time, we're using them as core stabilizers. They're getting a lot of, you know, basically external loading plus gravity pulling us down to use those. And then we're doing programs that have a bunch of, you know, chin-ups, and then maybe they're rowing for their conditioning and things like that. They're doing very, very lat dominant, extension dominant programs. And really, if we think about it, what are the things that can counteract that the best? Well, it's doing clean rows. So it's not just this, you know, scapular depression, downward rotation presentation, but also like this good protraction, retraction, where the scapula is able to move freely on the rib cage, get into upward rotation on a TRXY or something like that. So the stuff we do up here and the stuff we do around the rib cage helps to compete with a lot of the stuff that we use that really pulls down, you know, in a presentation like Nate's. So I think it's so important to appreciate that if you're going to do that stuff, you have to do it correctly, right? If you do all your TRXYs and your hands are down here because you're using your lats to tug yourself down and you're in lumbar extension, then you come over and you do your rows and you're in here and you're arched and your forward head posture. It's not just an exercise selection thing, it's an exercise execution thing that helps to make this training effect that we're trying to achieve. And that's to get rid of some of that lat tone and combine it with some of our positional breathing and some of our manual therapy and things like that to basically keep people out of these patterns where they're winding up with, you know, reduced overhead movement, but also symptoms that may come from those positions.